Good morning, Supervisor Baker. Supervisor McDonough, can you hear me?
Good morning, Supervisor Wickham. I hear you fine.
Good. Supervisor Baker, we cannot hear you. Oh, now he's unmuted.
Good morning.
There he is.
All right, I made it.
We can hear you now from your
All right.
living room.
Yes, this is a first for me. So.
All right. Welcome.
Yeah. Thanks. And it is 10 o'clock, and so we'll convene the Dubuque County Board of Supervisors meeting Wednesday, May 13th, 2020, 10 a.m. And first item on the agenda is approval of the Board of Supervisors meeting minutes for April 27, 29, May 4th, and May 6th of 2020.
I see that they've been modified to include those additional requests from Interim Director Ed Raber. So I'm happy to make a motion.
Okay, there's a motion to approve the minutes. Is there a second?
I will second that.
Okay, any further discussion? All in favor signify by saying aye.
Aye.
Aye. Carried 3-0. Okay, next item, item B, update from the County Emergency Response Team on COVID-19. So we would go to Patrice Lambert, our Health Department Director, and Tom Berger, our Manager of Emergency Management Services.
Good morning. This is Patrice. I can begin. I don't have a real lengthy update again this morning. I just wanted to share a couple of things that following up on Monday, Randy Gale did do in his daily update on the contact tracing. And I believe Mary Rose did a segment on her Facebook segment on Monday afternoon as well. So we will continue to try and get all of the correct information out or educational information out on the contact tracing so the public can see that. Another item is that...
Patrice Ann McDonough, we do have it on our Facebook page as well, the Dubuque County Government.
Yes.
So I was glad to see that it was posted there. So well done. Thank you.
Sure. And then the other item for a follow-up is with the new website from IDPH or the coronavirus. It does look like they have added additional information. So again, I would encourage people to go to that site, and then when you do click on Dubuque County, you can actually scroll down that page and you will be getting additional information that was not there, that I saw anyway on Monday. So it does look like they are expanding the information on that new dashboard. So that's good news. Another item that I just wanted to follow up with was on Monday, we had talked about doing our testing for the assisted living residential homes for this week for Wednesday, Thursday, and Friday. Well, unfortunately, we ran into some roadblocks. However, we are going to be doing testing. It took us a while to get through some of those roadblocks, so we will be doing some testing starting on Monday. We are looking at another population of we're hoping at least 1,000 people. We're looking at the assisted living residential homes. One of our roadblocks was that with assisted living, they're not required to have a medical director or to have an RN on staff. So those were some of the issues that we've been dealing with since the Monday meeting. But we were able to secure medical directors to be able to get the approval to continue with the testing. We just weren't able to get that done to be able to start the testing today. So it will be started on Monday.
Ann McDonough, I need to stop you again. Who is the medical director that's been assigned? I know that the medical director for Crescent was given more than 300 patients to be signed off on in the last testing round.
Yeah.
So
Sure.
Is that what we're doing again?
No. What we're doing, well, I shouldn't say no. I can explain it. What we did with our long-term care, they are required to have a medical director, so we were able to utilize those medical directors. There were a couple that did not have a medical director, so we were able to work with one of our hospitals in obtaining a medical director for those facilities. So the long-term care was a pretty easy, not easy, I shouldn't say, because easy is definitely not the word. It was a pretty smooth transition. And then with our contact tracing, we were able to utilize the physician at Crescent, which we were very grateful, because you have to have a physician's order to obtain any of the collection kits and to do the testing process. So
right.
now
the difficulty is that she's a full-time care practitioner also. She's my daughter-in-law. So,
sure.
I want to be sure that we're being sensitive to, we only have a few folks who can do this, and they're not on the incident team, and they're not in emergency management.
Absolutely.
Just to be aware that, what we're asking citizens to volunteer for.
Absolutely. And I'll have Stacy. I know Stacy's on this line. Stacy has been in communication with Dr. Cruzy with that, because we definitely know that that is quite a burden, and that has been a struggle for us this week. So with our continuing for our testing next week, again, I will have Stacy address the medical director component with that, because the assisted living residential areas that did not have a medical director, we were able to work with Stacy and her staff at the Visiting Nurse Association. But before I turn it over to Stacy, I will also add that if we do have any additional kits from these 1,000 kits that we're looking at for next week, again, Stacy and her communicable disease nurses will look at expanding our testing with how many kits we have. And we'll look at, I've already talked to Joe Kennedy about doing the law enforcement. But again, a lot of that is hesitant because our primary focus will be with the assisted living and the residential, and then we'll expand from there. So with that, I can turn, is Stacy unmuted, Dawn?
Can you guys hear me?
Oh, thank you, Stacy.
Hi, all. So thanks, Patrice. Patrice and the incident command team and I had met over the last couple of days, and we are going to, since VNA is no longer doing the contact tracing for next week, we're gonna shift into some testing, and we are going to help test some of the groups that Patrice had just mentioned that need it. We'll be testing probably most likely at our old building, because we have a nice pass-through garage, so we can bring people in through the Iowa Street and then exit through the alley. We're hoping that will work, and we will work under our medical director. So for the tests that we complete next week, which we hope would be close to the 1,000 mark, VNA will handle the notifications and also do the anterior nasal testing for next week.
And then, Stacy, do you want to explain your communication with Dr. Cruzy last week of offering to assist with that as well?
Dr. Cruz was amazing last week. I stayed in communication with her all weekend long as the results came in. I know she was definitely put on the spot. I think some of the test results came in at 2 a.m., 2:30 in the morning on a long-term basis. I know that that's not something that could continue, and her team, especially Tara Morgan and Brooke and Gary at Crescent, did a phenomenal job at assisting at notifying all of the results, both negative and then the positives as well once we switched over to contact tracing. We've been working very closely with Crescent, and I can't say enough good things of what they did stepping up to help with that community test site last week. I know Dr. Cruz had just emailed me a few minutes ago, and we had 314 people come through the actual test site on Grand River, and 27 were positive out of that group. So we now have all the results and all the positives for that group. It doesn't include any that were tested at the long-term care, but just at that testing site. Those are the results that came back in.
Stacy, this is Diane Pape-Freiberger. So those results come back to the physician that had ordered them, which in that case, it was Dr. Cruz. So then they report them to IDPH or to the state, or as soon as they become either positive or negative, is that reported at that time? So will it be included, those numbers be included in today's total?
I think some of them may have already, and I apologize, I'm not watching as close the day's total coming through the state because I'm just seeing what's coming through our notifications. But the process was that Dr. Cruz was notified, but then LabCorp also sent the positives and the negatives to Iowa Department of Public Health. Those results were then uploaded into their IDE system, which is their state disease surveillance system. And then once they get into the IDE system, then it gets reported out through the state.
This is Tom Beschen. Stacy, we've seen an increase in Dubuque County of about 23 this morning. I looked just before this meeting started. So the results are getting to the Iowa state record.
I know yesterday we saw just in our system now, again, not what's reported on the website, because I think there might be a little delay when those get reported to the website. But I know yesterday we saw our largest number come through the state system at 26.
Okay.
Okay, thanks, Stacy. So again, next week will be another positive challenge for us, and we hope to be able to do testing with approximately 1,000 more individuals. So that's all I have until later on but I think Diane Freiberger is going to report off on that next agenda item. So thank you.
Okay, other questions for Patrice?
Supervisor Baker, this is Ed Raber. I had a quick question.
Okay, go ahead.
Patrice and Stacy, thank you so much. Patrice, you had said that testing was going to begin on Monday for assisted living places and some residential care places. And you said that was going to be about 1,000 tests. Stacy, you had then said that you were planning to work on some other groups, and that might be 1,000 as well. I was just taking notes here. Did I conflate those two, or are those the same initiative of about 1,000 next week, or were those two separate things?
This is Stacy. So it's 1,000 for next week total. So
okay.
Focusing primarily on the assisted and residential, and then as we have more tests, however many we have available, we're going to try and stretch it out to some essential workers and those that work in the public that are at risk as well.
Okay, thank you. I just wanted to make sure.
And just to clarify, so our office will do the testing, DNA will do the testing, and then we will also obtain the results and notify the positives and negatives. So hopefully we'll be able to keep up with that number, and we anticipate that we should for next week.
Stacy and McDonough, another question. For the contact tracing, how many of those individuals did not respond? What of the contact tracing numbers still remain to be tested, and do we have a plan to follow that through?
I don't have an exact total of how many, but I believe that we tried to invite close to 1,000 when we did the initial community test site. We were able to get 314 to come through. And Patrice, correct me if I'm wrong, if those numbers are incorrect, but I think they're still one of the targeted populations, as well as the incident command team needs to find those that need to be tested next week. They would also be included in there.
This is Diane Heiken, and I just wanted to make a comment for Stacy and Patrice. Thank you for how you've been working on this and for the continued testing next week. And I think, people are getting an idea of how critical the order is for the test, and that it's not just the initial upfront order, it is the required follow-through and the continued patient care. It is a huge issue. I don't know if people appreciate how much Crescent has helped us and is continuing to help us. My understanding is they have multiple staff members working on this follow-through for us. And that is why we have to be careful how we proceed. It was suggested last night that the number that was thrown out, 10,000 tests by July 1st, might require like 10 full-time physicians and their staff to do that. So the test is not a simple thing. It's not just you issue an order and you're done. And so we'll be talking about that a little bit later, but I just really want to make people aware of how much Crescent is helping us in this.
And Diane, with that, I would also like to add, we cannot thank the long-term care facilities enough. They have been phenomenal. It's just been our good partnership, I think, with Dubuque County. Everyone is here to help everyone. And even the upfront, I'll be honest, with Stacy and I, that's pretty much been our full-time position for the last 2 weeks. So, yeah, it's, I agree. There's a lot of work with all of this. And again, with good partnerships, we have just been able to, we feel as though we were very successful in our testing last week, and we feel as though we'll be very successful in the testing next week as well. So,
thank you, Patrice. The long-term care facility were really helpful as well. Sorry, Todd.
Oh, they were wonderful.
No problem. I just had a question out of curiosity because I think Stacy made the comment that the universe of people identified through contact tracing is about 1,000. And given the more extensive testing going on in Dubuque County, I don't know, like, if there's any projections, like how big that group could potentially increase. Will it be significant? I guess it's just a general question to gauge that group of people.
This is Stacy. I think that group is going to continue to grow. Every new positive we have adds on additional people that may have been in contact. So I think that number is fluid, and I think as we find more and more positives in our community, that contact tracing group could become very, very large and be a continued concern over long periods of time, definitely not in the short term.
Stacy, would it be possible, and maybe you're already doing this, but to some of the folks in that contact tracing are groups of individuals that have familial relationships and maybe misunderstanding of what to do and how to do and how to go about responding to their notes or emails or cards in the mail or a combination of all those systems. Can your office start to, fine-tune the detail of who has not responded and what the barrier is or their lack of understanding? In congregate setting, we're going to pass a declaration here, I think the Board of Health will. So, the setting that these individuals live in and their relationships, that's a key part of that contact tracing group. So are you changing the way we're doing something?
That is something that we've worked on. I know prior, and I had mentioned this in previous meetings, that with the contact tracing, when we were doing the case investigations for Iowa Department of Public Health, we were held to such strict deadlines in terms of time that took a lot of our manpower, so to speak. And so now that we have that relief off, it allows us to look at that because we still continue to get all the data so we can see the addresses and the names of those that are positive and can identify the trends or if multiple people in one home or things like that. And that does give us the ability to work with them. And so we worked pretty closely with Kelly Larson and her group. Anytime we identified somebody that had additional needs or ways to, stop the spread within the home and make sure that they do understand the social isolation and the guidelines. And so now that we do have a little bit more time, that is definitely a top priority for our office, because I think that's a way for us to start to eliminate the spread.
But more than time, because time is people. do you need to hire more staff? Do we need to do something to increase hours for you? Because that's time critical service as well to, reach out to those individuals, make them aware, and then also the importance of what we're asking them to do. So, the visiting nurses kind of go into the home. Can you bring more people on to help make that happen in a faster time?
And we've done that to some aspects, and I've been very transparent with both Tom Beschen and Patrice. We've done a lot. We've moved to 7 days a week as opposed to, your traditional office hours. So I have no problems communicating with both Tom and Patrice when we need additional time or when we have to add in additional staff. And so, we definitely look at that and watch that closely. And if we need additional staff, we have quite a few staff members that have all been trained and have already helped thus far, and will continue to do so as needed.
Thank you, Stacy. I know that you are working endless hours, and I appreciate that very much.
Thank you, Ann. We appreciate all the support we're getting from both the Board of Health and the Board of Supervisors, and Patrice as well.
Stacy, this is Diane Heiken. Just one more quick question. Who is the medical director for the VNA? I'm not aware of who that is.
Our medical director is Dr. Brian Pecos.
Okay, and he's fine with the ordering of the test next week?
Yes.
And he's doing the follow-up. Okay, thank you.
We talked with him in advance and set up a system, so then that way the results come back to VNA, because I think we're in a better position to do that follow-up and have a better understanding of the groups that we're testing.
And can you give me an idea how many staff you will have working on the initiative next week then, both the testing and the follow-up?
Right now, what we're proposing at the moment is to have 2 stations running 4-hour shifts, so 8 hours a day. So we would have 4 nurses and 4 non-medical staff helping with the grading and the paperwork, working, so it'd be 4 people every 4 hours all week long.
So, and then they're the same people doing the follow-up?
Then we'll have additional staff, and then some of those that will do the follow-up. By setting this out throughout the whole week rather than just a day or so, which we really couldn't do, it gives us a little bit additional time. The results will come in staggered, so we'll be able to redirect staff into helping with that as well. So we feel with this group we should be fine. I think if we look at going into the future and anything long-term, I think we need to reevaluate, because, we do have other programs that need attention from staff too, and maybe at that point is when we look at additional staff or additional time. But for this week, I feel like we're very well set up. I spoke with all of my staff this morning, and we do actually have staff coming in from our Clayton office to assist us next week with the testing.
Thank you.
Stacy, this is Diane Page-Freiberger, and I just want a clarification here. So Brian Pecos is your medical director, but the results are not going to Brian or Dr. Pecos. They will be coming directly to VNA for you to be able to receive those. And if you need, you would refer to Dr. Pecos if you needed further direction. Is that correct?
Correct.
Okay, that's just a follow-up from last night, some of the issues that were discussed last night. So thank you. So there is a system that can be set up. Okay, thank you.
And oh, that's okay. Right before this meeting, I was just on the phone with LabCorp, and I'll be honest, they're still checking to make sure that the results could go to the VNA, but they're almost wondering if it shouldn't go to the medical director first and then to Stacy. But regardless of the follow-up, Stacy's staff will be doing that. So we're just clearing a little bit of notification or contacting with that, but it does sound as though it's going to be a go. So with the lab sending them to Stacy. But the worst case scenario would be that they would go to the medical director. The medical director then would give them to Stacy. But it does sound like we were able to clear that path, so which will be good. And I can't say enough about Stacy and the VNA. They have been phenomenal through all of this. So thank you, Stacy.
Okay, any other questions for Patrice or Stacy? Okay. Tom Berger, is Tom on?
Yeah, I don't have anything else to add, Dave, unless anybody has any questions.
Okay. I guess, Tom, just are all the, we okay with PPE and masks, et cetera?
Yes. Yeah, we're doing good. In fact, I probably won't need to order from the state this week. So requests were slowed down quite a bit this week. So I think part for people getting agencies starting to catch up on their supply chain and getting it direct in. So we're sitting pretty well.
And does that include the gowns, isolation gowns, et cetera?
Yeah, I mean, it's still, we're limiting them to the healthcare facilities, but yeah.
Tom, this is Diane Freiberger. Is that including the N95 masks, or do you still just have the KN95?
Mainly have the KN95s, which the documentation is they can be used in conjunction with the face shields, yes.
Thank you for that clarification. Thank you.
Mm-hmm.
Okay, thanks, Tom. Any other questions for Tom? Okay, with that, we'll go to the next item on the agenda, item C, which is Board of Health update. And this is where I will virtually turn the gavel over to Chair Tom Beshen from the Dubuque County Board of Health.
Thank you, Chair Baker. I'll call the meeting to order of the Board of Health, and I see by the attendance that we do have a quorum. Members present from the Board of Health are Tim Daly, Todd Lang, Diane Heiken, Diane Freiberger, and myself. So the first item on our part of the agenda is the declaration of disaster emergency. That was included in the packet. And I would ask if there are any questions regarding this document. The purpose of the document is to open the path that we can qualify for FEMA funding in connection with the facilities required throughout the county for isolation housing. Dubuque City Housing Department has taken the lead on this, and with this disaster declaration, we would be able to utilize those for non-city residences or non-city residents as well. So that is the purpose of this declaration.
Tom, this is Ed Raber.
Yes, Ed.
I would have to say that from the conversation that Dawn Sherman and I were able to have with city staff yesterday, you are correct that this is going to allow any local jurisdiction in Dubuque County that is providing non-congregate housing to seek reimbursement from the Federal Emergency Management Agency, FEMA, as opposed to using other sources of funding to do that. But they communicated to us that as it stands right now, the city's shelter that they're primarily using is still going to be primarily for residents of the city of Dubuque. And so that was probably, as Dawn and I fleshed that issue out with city staff, I don't think that they're ready to say that this will then be open to everyone around the county as a preference. I'm not saying that they're going to turn someone away, but they made it clear that this is their shelter, and until they understand otherwise, it's primarily for the use of city residents. So that is potentially a change from our initial understanding last week.
Well, so what you're telling me, Ed, is that county residents may not benefit from this at all.
They certainly could if another shelter was established, or if an additional arrangement with for any of the primary, secondary, or even tertiary shelters that the city has made arrangements for. They're only using one primary one that is their preferential one.
Okay.
So if we were to do that, if another community in the county were to do that, they would also be covered by this declaration.
Okay, so as I see it, the purpose of the declaration has not changed.
Correct.
The beneficiaries of its enactment is at question at the moment.
I don't know that it's in question. I think all of the residents of that shelter, which is about 10 right now, happen to be residents of the city of Dubuque.
Okay.
Right, but of course, those are residents of the county. I mean, we're one county, and so, the concern that we have, of course, is to get this ready and to reach back to get the proper funding to support the FEMA funding. So we're taking the best dollars first.
But if I understand correctly, Supervisor Wickham, is that if you're from Epworth, my hometown, or Cascade or Dyersville, you will not be able to use this facility?
No, that's not a correct understanding. They are not turning anyone away.
Please, somebody correct me then.
Right.
That's not what I heard. Somebody corrected.
That's what Mr. Raber said. They're not turning away. They're saying the preference is the city. It's being done by a city with city resources being done in addition to FEMA dollars. So no one's being turned away. As soon as we have an issue in your hometown, Jay, I'm in contact with those individuals. We'll work out that detail then. No one is excluded. It's all for public health.
Good. Can we get that statement from the city of Dubuque? Ed, can you work on that to get that statement in writing?
Yes. So Dawn and I, as I said, we had a meeting yesterday with them, and as she and I both agreed, we are going to need to follow up with them later this week. The city of Dubuque, on that, I realize we're in discussion about a declaration, Chairperson Beshen, but the city has released a request for proposal for staffing last week, and I've provided that. That's been communicated to us, and Dawn has reviewed that. That was part of our meeting yesterday.
Okay.
And
all right.
This is Dawn. Sorry, can you hear me?
Yes. Yes, we can hear you, Dawn.
Okay, so I'm making the mic. In our conversation yesterday.
Cannot hear.
I'm getting feedback from requested access.
This is Supervisor Baker. I'm not able to hear Dawn.
No, Is she in the boardroom?
Yes, stand by, everybody.
Oh, this is Dawn. Can you hear me now?
A little echoey, Dawn. Turn the volume down.
Yeah. I don't think this is going to work.
You are muted.
You are muted. You are muted. You are muted. You are
Nathan, can you kill that mic?
Muted the conference phone, Dawn. This might take a minute, so if anyone else wanted to continue on, I'm working with Dawn.
Okay. The discussion we've had so far, it appears to me that I think we should move forward, but there may be another task involved, and that would be to see what needs to be done to mobilize an isolation center outside of the city of Dubuque should our need arise and the city of Dubuque is no longer able to satisfy that need. So I think that's the next step, but I don't see that delaying this declaration would serve a purpose.
Chairperson Beshan, this is Ed Raber again. I would add that if the county were to, I would recommend that the county continue the discussion that Dawn Sherman and I had with city staff about the opportunity for collaboration on that. If it meant that there have been no cases where county residents were unable to isolate themselves in their own residence or some other accommodation. The isolation facility is primarily for individuals that can't return back home after they've been determined to be positive. So we discussed some of the risk assessment around that. There hasn't been anybody that's positive out of the 200 plus that have been positive so far that have been referred for isolation that were not able to do that in their own residence or some other accommodation that they arranged. And so we talked a little bit about that in terms of what's going to happen in the future. The rest of Dubuque County that is not the city has a different sort of residential characteristic to it than the city does. And some of the residents that have required that isolation, they have been from the city. It would also not mean that if the county were to try to make some arrangements for that circumstance, that it would have to be outside the city. It could be inside the city as well. It doesn't mean that it can't be in the city. It just might not be the city's facility.
Okay.
Did that make sense, Tom?
Yes, it does.
Okay. So we're going to continue with those negotiations that I had, or that discussion that I had reached out to Alexis Stager about. I think that's what Dawn would probably say if she was able to comment.
If we could get clarity on that, because your comment, Ed, is different than Supervisor McDonough's comment about them allowing them in. So I'd be curious if we get in writing, what is the statement related to that facility? If it is unavailable, then I'd need to know that.
Right. And
I would ask Mr. Raber, please include me in those conversations with the city, because I think things are being mischaracterized. So I'd like to be involved in those conversations as well, so I'm not getting reports from you and Dawn. Thank you.
You bet. In writing would be the best. And if the city's facility, that's okay. We just should know in writing what is the position, so we're prepared.
Yes.
I would also offer, Ed, this is Tom Beshan, that if you need or want my involvement in those conversations, just ask.
Yes, thank you.
Okay, so I see the boardroom is still muted, so I guess the path I would like to follow at this point would be to move forward with the declaration. Let's not have this stand in the way of any action that has to take place. So, is there any discussion from the Board of Health members?
Tom, this is Diane Heiken. I'm willing to make a motion. Can we do that at this point?
Yes, we can.
Okay. I move that we approve the declaration of disaster emergency as presented to us.
This is Diane Pate Freiberger. I second the motion.
Okay, so Diane Heiken and Diane Pate Freiberger.
And Diane Heiken again, Tom. So this does cover the entire county. So by putting this in place, we are prepared to address all members of the county.
That is correct.
We need it. Okay, thank you.
Okay, any discussion? Hearing none, I would call for a vote. Tim Daly?
Aye.
Todd Lang?
Aye.
Diane Heiken?
Aye.
Diane Pate Freiberger?
Aye.
And Tom Beschen? Aye. Motion carried 5-0. Thank you very much for the explanation, Ed, and as we move forward, let me know if you need anything more from the Board of Health.
Thank you, Tom.
Okay, so with that, I would turn it over to Diane Pate Freiberger. I know the test group met last night, so if you can update us, Diane.
Thank you, Tom. And I also have to say thank you to Stacy and Patrice for, after their long days and many long days, that they participated last night in this conversation. It really helped to have more individuals present for that discussion. So last night, members of the Board of Health Testing Committee, which includes Diane Heiken, Bobby Canaro, and myself, met with Gwen Driscoll from Mercy One, who is the lead for the testing site committee, and Patrice Lambert, Stacy Killian, Gary Collins, and Brooke Gomez from Crescent. Agreement was reached that a 2- or 3-pronged approach can be taken to increase testing in Dubuque County. The first would be to continue testing with collection kits if distributed to Dubuque County as requested by Patrice. And that would include the 1,000 starting next week. Additionally, the Board of Health Testing Committee instructed Patrice Lambert to request another 6,000 anterior nasal swabs from IDPH to continue testing specific populations that we discussed last night that have been identified, and the testing would go through July 1st, 2020. For this initiative to continue, IDPH approval and LabCorp availability is required. With this initiative, Crescent Community have offered to test specific populations identified and discussed that last night. Those populations were identified last night, and they were going to talk to their medical director today to make sure she was on board with that, but they felt that there should not be an issue because they're already serving these populations. Crescent has a very limited volume of test collection kits, and we would require more to obtain the samples. So if we're getting the intranasal kits from IDPH, we would need to supply them to be able to testing of those specific populations. The second prong would be to discuss with GDDC in offering a plan to target employers in Dubuque County who want their employees tested with test kits from United Clinical Labs and Mayo. With this initiative, the employers would utilize their existing insurance with no copay to the employees. Ed Raber is reaching out to GDDC and has also had discussions with them. And also with this initiative, a medical director would be required to order the testing. Also requested is if they have a nurse on site or if they are in collaboration with occupational health departments that has the staff to draw the samples. Patrice is checking the PPE required for utilizing the oropharyngeal swabs supplied by United Clinical Labs, which would go to Mayo Clinic. The third prong would be to offer increased testing at a specific remote location, utilizing the system with United Clinical Labs, as we addressed last week, of providing the collection kits and sending the samples to Mayo Clinic to run. This site would be utilized to obtain samples from the general population and from smaller employers that may not have a location for testing. A medical director would also be required to order the tests, and PPE requirements are being checked out by Patrice. Our medical liaison from the Board of Health did offer to write the standing order. He just doesn't have the time or the staff to deal with the results coming back in, especially after he heard what happened with Dr. Cruz last week, and through this week. And so that could be worked out. We would have to look at a system for that. I have requested input from the full DCHCP testing site committee to see if they would like to work with members of the Board of Health in developing a strategic plan for increased testing in the short term and the long term. And they met this morning at 8:30, and I requested a response from them for their participation so we can set up a meeting. Are there any questions? Patrice, you might want to offer, if you have anything. You were on the meeting, or Diane Heiken was on the meeting last night. Stacy, you were on the meeting last night.
I do have one comment. This is Diane Heiken, and you can all correct me if I'm wrong. I was thinking that with the third prong, by talking with the local medical providers, as you requested, the group that was formerly the test site subcommittee, that we were hoping not to necessarily need a medical director, but that each of those individual clinicians could order a test for a patient. Isn't that what we're thinking more, the collaboration with that?
Yes, that's why we wanted their involvement. We would need to get approval from those medical providers to do that.
Right, and if we can get medical providers, which is really about the only way we're going to be able to do this, to collaborate as a community, if they can be involved with the planning and the execution, if we can come up with one order that they all agree to, which has happened with other models, other counties have done this, and they're comfortable with it as providers, then they can be one avenue to follow up with their own patients within the community, to order it and follow up with their own, if that makes sense.
Yes. Patrice, you have a response there? I know I heard her voice earlier with a question or statement.
Oh. No, I was muted. So now can you hear me?
Yes.
Can you hear me now?
Yes.
Okay, good.
Now we do not.
Okay, now I'm on. Thank you, Dawn, for helping me unmute. I don't know why I can't do it, but this is Patrice, and yes, what you had said, Diane, was of what I recall from last night. I have not had a chance to contact IDPH in the couple of hours that I have been working so far this morning, but I will follow through because I think that will be a major factor in obtaining 6,000 additional kits if we can from the state, because that would be no charge whatsoever for those collection kits, nor no charge at all for the testing process. So that would be, I think, very beneficial for Dubuque County if we were able to do that. And again, we have a wonderful working relationship with IDPH in the state right now. As I said, we'll be looking at another 1,000 testing participants next week. And again, the state is not charging us anything for those. So that's it. Thanks, Diane and Diane.
Stacy, did you want to offer anything? I know we talked about DNA staffing or being able to support some of those employers. if they needed some support there.
I think, I just want to add that, going through that meeting last night, I think there's some wonderful ideas and a lot of great initiatives. I think, like you guys had mentioned, it's definitely a parallel approach. I think there's a lot of moving parts and different ways that we can all utilize our strengths and work together. I agree with Diane Heiken. I think bringing in some of these medical providers, I think a partnership is going to be critical for the success of this. And in terms of the businesses, I think, looking at the calls that we receive in our office, they do have a lot of questions. They have a lot of concerns over the safety of not only their employees, but any patrons that come in and utilize their services as well. So I think starting there and then also branching out to assist them in more of the policies and safety procedures as we start to open up more businesses throughout the community, that's going to be critical to our success to stop the spread. So I commend the group for really persevering forward and having a clear vision and bringing on the right partners so we're all in this together.
Thank you for all your work too, Stacy, and for all your nurses. Thank you.
Thanks, Diane.
And just to clarify, Ed just sent me a message. As far as with the third prong, that would take collaboration with United Clinical Labs, to, as we had previously stated, they would issue the 200 collection kits and we would send them to Mayo Clinic, and then they would replace them back to United Clinical Labs, and we would continue with that process. And with some of these will be covered with their employers. But smaller employers do not have the facility, they do not have the location for their employees to come in. So if we set up, and it would not take opening Grand River, okay, we just had this discussion last night, and I really don't want to offer the plan at this point, but we do have other avenues that we can explore where those employees can come in at a specific time, have an appointment to come in to be tested if that employer is requesting them to be tested. And then their insurances also would be covering this. There may be some that the insurances are not covering. We do not know that number until we've had contact with these employers.
Right, and Diane and McDonough, so the key piece still before we can branch out to do any of our subcommittee's thoughts is identifying an actual MD, medical provider, medical director who's going to take on the task of being responsible for issuing an order to allow small employers to proceed and big employers. I mean, we have to recruit, maybe we're going to have to hire our own county medical examiner, director of medicine to take this forward, because that's a critical piece. We can purchase a test kit that doesn't get us to the end. We can find a lab that'll run the result at $147. That doesn't get us to the end because we don't have each of the pieces. So I appreciate very much that the conversation is beginning and that we see more clearly the puzzle and the pieces that fit in. We start to see better what that image looks like. So I appreciate all your hard work. I'm just recognizing every day as I learn more that there are more pieces that I didn't know were even missing.
And thank you for that comment, Ann. And just to let you know that some of the larger employers actually do have medical directors that may be a corporate medical director that they're employed to do this, to be able to write the standing orders for those companies. I would expect that with the smaller employers that they probably do not have that. And we may then need to, in taking the appointments, we may have to find out from the individuals who their primary providers are and get that order from them so they get the result back.
Right, because those medical directors, as a corporate medical director for company X, I certainly am not creating a patient relationship with each of my 600 employees, doctor-patient relationship. And the way these reports come back, as I understand them, there's follow-up that needs to be done as a medical provider, not just, this is not just paper pushing. When the reports come back and your test results come back, there's care involved. to make sure that you've completed the purpose of the test and to begin any care of symptoms.
That is correct.
And this is Diane Heiken. That's where it gets to be an intricate kind of relationship. Even if we were to hire a medical director, you want the person to have a primary care provider that's involved in, the ongoing care. So what we tried to do, Anne, was address with each of those prongs that Diane laid out, who could be that person. So with the first prong, which is the continued relationship and collaboration, hopefully with IDPH and LabCorp, I'm assuming it would continue to be VNA, as they are doing next week. But we don't even know if we'll get the additional 6,000. But we do have the 1,000 next week, and so that medical piece has been addressed. It will be ordered by Dr. Pecos, and then VNA will do the follow-up, under his direction. The second prong, what was your second prong, Diane? That was the employer one, correct? And with that, we asked Ed to work with GDDC, and they have apparently a list of different employers that have contacted them, and they want testing for their employees. So our direction to him, or our request, was to, if they have all these contact names from these companies, to send an email to them with, I believe it was 3 questions, Ed. One of them being, if they want all their employees tested, we can't have it all the responsibility and follow through and everything on us. We're willing to work together. This is all about collaboration. And so, Ed, if you can step in, were there not 3 things we asked you to have those companies address, including, do they have someone that can order it? Do they have someone that can address through human resources, the insurance filing? What was the third thing?
A staff to be able to obtain the samples and a location to obtain the samples, like a conference room, or do we need to take have a van of some sort set up to be able to do these?
A mobile test. Okay, so we're looking at that for the second prong. And that third prong really involves the collaboration from our local medical providers. And them, assuming some of the responsibility for, as you said, Anne, ordering the test and then providing the follow-through, we've got to assume there's going to be positives. And we're trying to look at something that might be a sustainable model moving forward. Because as someone mentioned last night, we have a whole lot of colleges that if they resume in the fall, they're going to have a lot of people coming back. And it's the congregate living that can be very dangerous. And I do want to clarify, too, when Diane mentioned that Crescent was willing to help out a little bit more in the future, the things they seem to be comfortable with were the congregate living populations. I think that tends to be something they're very comfortable with. So we don't want to be relying on them a lot moving into the future, but they did express comfort with those populations, the congregate living. But we have a lot of situations that are going to continue to come up as we move forward. And so we can't just look at the short term only.
Right. And so, people are ill when they're asking for the test. So it's not just, oh, I'm positive, great. At least I know I have COVID-19, right? However you process that in your mind. But there are people who are being tested who don't feel well. So you get back a result, and that doesn't mean you sort them into the positives and the negatives and everything's done. There is care for those who are ill but don't have a positive test result. People have tremendous questions about whether or not it's a false positive, I feel fine. It's a false negative, I feel terrible. Why am I not being told that I have what I thought I had? So, I guess that's what I'm trying to stress is that getting this to start, we need to have commitment from many people in the medical community. And not everybody has insurance anymore. We've tied insurance to employment. That ship has sailed. So, how are we going to make sure that people are getting the care and attention that they need to understand? You still feel terrible. You got a negative test. You should still stay home, right? I mean, there's the nursing care and all the follow-up. So, to take on 1,000 next week, let's try to digest that, just like we did with, our 1,500 and our 600 no-shows for our first set of testing. So I applaud you all, and we're making great strides. But before we set our target so far out, we need to find a way to make simple things happen.
And Anne, thank you for that comment. And that is why we've invited these medical groups into this discussion. And hopefully they respond and are willing to participate. The question that came up last night, or the statement, was that the individuals that are on that testing site committee members were only set up for a surge. And we're talking about something different here. So that's why I sent that email out this morning requesting them to now change their focus, because we have so many moving parts and so many things changing on a daily basis. Are they willing to change their focus and coming to discussion with us to develop this strategic plan? And that's why we invited the medical provider groups, including the hospitals, Crescent, and Medical Associates Grand River.
Supervisor Wickham, I definitely like what I'm hearing. Seems like there's a lot of good collaboration and work going. My only statement would be let the Board of Supervisors know if you need additional resources or additional funding. We're behind you 100%.
Thank you.
Thank you. That did come up last night, I think, in talking about staffing possibly for, the VNA, and we told them, require the full support of the Board of Health. So we appreciate that you're letting us know that funding might be available if we go beyond what you've already given us.
With no further questions or statements, I will refer back to Tom Bishop.
Okay, thank you, Diane. Any other questions for the Board of Health? That concludes our portion of the agenda.
Okay, thanks, Tom. All right, next up on the agenda, item D, isolation shelter sites.
Supervisor Baker, this is Ed Raber. The discussion around that, I think we just had that in the last agenda item. I would add that, because I don't know if Dawn is actually on here, we had a brief contact meeting yesterday with city staff and anticipated another one. I think Dawn wanted to kind of digest some of that, and I heard the comments from the Supervisor Wickham and Supervisor McDonough. I'd like to, we were planning on having another meeting with them, maybe later today, it could be tomorrow, but we'll be doing that promptly. And I'd like to say that we're going to ask Supervisor McDonough to join us on that.
I would like to be considered a necessary party. Thank you.
Hi. Can anyone hear?
Okay, I'm very comfortable having Ann as Board of Supervisors head in the tent on this issue.
Thank you.
Okay, any questions for Ed on the isolation shelter sites? Okay, next up is item E, discussion regarding public access to county buildings. Refer to Dawn Sherman to start the discussion. I hope Dawn's able to speak by now.
She tried a minute ago and there was some feedback. We're going to have her go to a different microphone.
Okay, thank you.
All right.
Hello.
Can you hear me now?
Tanya, is that you, Tanya, or Dawn?
No, this is Dawn on Tanya's. Can you turn it?
Okay, we can hear you.
Okay. So currently, you have the public access to the county buildings for the courthouse and West Campus. We have that in place through Friday, May 15th. So we're looking at some guidance for that and discussion regarding that. And I'll be right back.
I know the governor was supposed to give us some direction yesterday, but she punted to today's conference, which should be starting. So I am focusing on this meeting, but if anybody out there has any input, they can message us here. But I guess we need to discuss whether we go past May 15th. And we tried to vary from the governor, and we're told that only the governor can put orders in place. So, I'm open for, yeah.
Oh, thank you, Chair. In some of my discussions and emails with department heads and other employees, there is still some outstanding issues regarding, would we require masks to be worn by the public? Would we provide those? I think there's still some concerns of opening it back up at this time. I think we need to look at some more reopening and strategies for our facilities to get those teams together, because there's still some, we've done some steps already, some plexiglass, some signs on the floor for the social distancing. But I have made most, if not all, of the elected officials and department head co-hosts, so they are able to unmute themselves if they would like to speak on this issue too.
So I guess since my employees are going to be the ones that are going to be at the front end of this with security, we're working on getting some face shields for them whenever we decide to open up. Obviously, our employees are all retired officers, and some of them are in the high-risk group, so we're going to have to secure a little bit more personal protective equipment for them before we're ready to open up. Knowing that the court is at this point set on opening up on June 1st, there's a lot of things to consider as far as what items are going to need to be cleaned in between use. We have limited number of tubs down at the front desk. Who's going to clean those? The access areas in the courtrooms, anything that people touch. I don't know what else the county is going to be able to do to be able to afford cleaning up after every person that enters a building. I think I guess I'll leave that to Chris because that's more his area, but there are concerns with allowing all these people into the building and then not having a plan on how we're going to adequately clean the surfaces and what surfaces are going to have priority, and really who is going to be allowed in the building. For take jury trial, for instance. Okay, so once jury trials open back up at this point in mid-July, the day of jury selection, we're going to have who knows how many people coming in just for that jury selection. There's a lot of things that have to be considered before we get started, but I think we need to keep this conversation moving forward, knowing that June 1st is probably going to be an open day for the courthouse, or need to be, because if the courts open up, yes, we've said they could use the juvenile courtroom over here if needed in emergencies, but we can't handle 4 different hearings in the juvenile courtroom. That's one space.
Well, Joe and McDonough, the first thing I'd like to say is, we're talking about frameworks, and I think it's important to put into this discussion. Thank you to Randy Renison, who's saying that Governor Reynolds just opened everything up in all counties. So we'll see what that actually means with her proclamation and any lifting of restrictions. But we did not close our courthouse, and so our courthouse is open. And I have been saying that on Zoom. It has restricted public access, and that's because it's a smart and safe thing to do for the public and for our employees. And we will meet the court's deadline of when they need us to be open. But I was hoping that as we begin this conversation much more aggressively, there's a new normal coming, and I don't think we can just, bury our head in the sand and think it's not going to happen. But with restricted public use and restricted public access, each of our departments should be submitting to Ed Weber and to Dawn the written way forward. What does it look like? Describe for me. I'd like to know exactly the things you're saying, Joe. Perfect. Face shields for deputies. Numbers of people that could be in the, we're going to put footsteps outside the courthouse and line them up around the block because we're going to keep 6 foot, social distancing. So, describe what it will look like, because that's how I will be making my decision, is based on what you think it needs to be to keep our employees safe and provide the best customer service we can in the new normal to our citizens. So, it's not, I think that's vital. And Dawn, I don't know if you're working toward that, if our other department heads that are on, but it would be helpful to me to see it in writing so we for sure capture everything.
Well, and
I would support that approach as well. I think that's well said.
And I think I guess if we're going to open it up, or which we're going to have to do, but as far as access, say we get to a point where we have a jury trial, I assume that we're just going to let everyone in as needed. I don't necessarily think it's the responsibility of my courthouse security people at the door to be counting the people coming in the building, to be asking, where people are intending on going, or screening people and only letting in people that are on specific lists. We don't have the staff for that. We would have to have extra people at the security checkpoint, and in addition to the people moving around the building. So, I think we need to consider that as well.
And I wonder if the jury selection is the issue, Joe. So when you drill down to that, if it's when we have a large crowd of those folks who are called for the jury pool, someone is suggesting, can we go somewhere else? Could we look at, gathering in a different location before we all come and proceed to the courthouse? And I value your comments about, Dave, I don't have staff to do that, and that's not really what your team signed on for. Ultimately, law enforcement supports whatever the need is in the county as well, and the genuine discussion we're having today is an important piece of that. So maybe schedule some work sessions into, Monday of next week to really we can weigh the departments based on their individual circumstances and the input from those who are elected officials. I don't know better than you, Sheriff Kennedy, so I want to be supportive and do the right thing for your folks as well. So I think this is a great discussion to begin, and our chat room is filling up with people who do want to have comments be made. So whether we read those in or we unmute mics and I don't know how low we want the perimeter of this discussion to be in a more ad hoc fashion, which is what we have now.
So this is Shane. I don't know if everybody can hear me or not.
Yes,
I just wanted to comment as well, just with Joe. So as far as the court stuff, I don't know how many people have seen it, but the judicial branch actually put together a task force that is currently, I believe it's made up of judges, county attorneys, public defenders, with input from sheriffs, trying to determine how they are going to handle that process and make a recommendation. And I believe they were supposed to have something, I believe it was 4 or 6 weeks prior to jury trials opening, which isn't until the middle of June. The more at hand, I guess, concern is when we do decide to open up, yes, it's all of those issues of how are we doing it, what are we doing as security at the checkpoint, who are we allowing in. I know some departments have said if we open up, they may have their own idea of when they're going to even allow their door to open into their office, even if the courthouse is open. So we need a lot of communication between courts, individual department heads, supervisors, as far as what direction we need. Again, I know a lot of buildings, businesses are doing masks. If you don't have a mask, you have to have a mask. If you don't have a mask, are we providing a mask? Just some of those concerns that we need to know. Again, all of those issues are the things that are going to directly affect my staff, again, and the sheriff's office staff, who are, again, some of them those high-risk category individuals.
This is Chris. One of the things we've implemented so far is we've got temporary employees doing the cleaning and stuff like that. We could move forward with expanding that role with having them, counting people in and out of the building and that sort of thing. The other thing is I've been talking with Linda Nilgis, and we are going to be providing cleaning supplies for them to clean the judge's bench and each of the tables and the court reporters area. And we've also talked about what we're going to need to do to create the social distancing, even in the areas that have the pews or the benches rather than the chairs. It's going to it's really going to make a change in how many people we can have in any of these rooms. We're going to basically, if it says 96, we're only going to be able to get like 50 people in there. And that's another consideration that's going to have to be taken. We're also building dividers for all the cubicles and stuff, and we're also building, basically sneeze guard screens for all the countertops, like as in the court, in the recorder's office and some of the other offices. So I just need direction as to when we need to, we're already implementing some of this, but I need a timeline so we can finish implementing, as well as getting all the correct signage we need for all the courtrooms and the other common areas.
This is Dawn. This is Dawn. I have not heard any feedback from any departments saying that we need to lift the restrictions at this point. There's no operational hardships, to my knowledge, that are going on because of those. I would recommend that we take this next 2 weeks, if we extend this through May 31st, to team with our courts and get all of our resources with a plan together, so that the courts are anticipating having open on June 1st, and that may be a good time for us as well, and it'll give us some time to get our plan together and especially communicate that out to the public.
This is Judge Schubert. Regardless of when the deadline is, if it's extended beyond the current, we don't plan to resume any judicial operations in the courthouse beyond the very, very limited scope of what we've been doing prior to June 1. So regardless of what the board decides to do, we are looking at June 1, which is our latest date that we have received from the Iowa Supreme Court. I do not anticipate that date is going to change. Briefly, the reopening is going to be somewhat of a staggered reopening. We're limited to just doing criminal hearings on June 1. If there are criminal bench trials or just civil hearings, we can start doing those June 15th. Criminal jury trials, which I think are the biggest challenge that we're facing, are not scheduled to resume prior to July 13. A couple people have already referenced the challenges with criminal jury trials. They are many. There is a state task force that is working on the problem. I think Shane referenced that. So we are waiting to hear some guidelines from them. However, each of Iowa's 99 courthouses, actually I think there are 100, one county has 2, are their own setup. And everybody's different in terms of how things can be accommodated. But we are they're talking at the state level, we're talking at the district level, and we're also I'm going to be talking with the other judges at the local level about ideas as far as bringing people in for jury selection, how we're going to seat them, whether we're going to have to use more than one courtroom, which is likely. That exacerbates a problem that we've had for some time that I thought we were moving towards solving before all of this came up, which is we are a courtroom short, and we're hoping to get that first room courtroom up and running. That was a necessity before. It's really becoming an urgency now because we are going to be so backlogged on hearings, trying to keep the court schedule moving forward. We're just going to need that space more than ever before. And particularly with jury trials, if we bring, say, a panel of 40 people in with spacing, we're not going to be able just to sit them all in the north courtroom. So we're going to have to break those people up somehow. We're going to have to use another courtroom, and that's another courtroom that cannot be used for a hearing or other proceeding. We are going to continue to try to use video and conferencing as much as we can, even when we open. So anything that we can do in that fashion, we'll continue to try to encourage parties to do. But there are just certain hearings that really do have to be done in person. And a lot of those, if they're not matters of urgency, those just have not been happening during the break. But the ones that have been urgent, we have been doing by video or by phone. But there's still a big backlog, and we're going to feel that for some time. I don't know what else to say at this point. I can certainly try to answer any questions, but like I said, there are some discussions going on at the state level, district level, and local level, and we'll know more after we get deeper into those discussions. Does anybody have any questions for me?
I just have a quick question, Judge Schubach. This is Sheriff Kennedy. Chris Soder earlier was talking about the amount of cleaning supplies that they had. Would it be agreeable for, obviously he cannot have enough people around to clean all the spaces that all the attorneys touch when they're at the courthouse. And maybe this is a question also for CJ. Would the courts and the attorneys be agreeable if the county provided a box of gloves and some cleaning supplies to wipe those tables off before they leave the space so that it's clean for the next person?
Joe, this is Chris. I met with Linda Nilgis via email and telephone call, and one of the things we will be providing is cleaning supplies for the courtrooms and whatever other areas the courts need for them to do that sort of cleaning. Beyond that, it's going to be up to how the staff want to do it. I agree. I don't have the manpower to do the necessary things that we're looking forward to having to do as we continue onward.
And obviously, I'm not talking about them cleaning the entire courtroom. I'm saying, they go up, they sit at their individual tables, they wipe off their chair, they wipe off the table in front of them, and then they walk out. I mean, it will literally take a minute or two.
Or you could turn that around and have it be the responsibility of the people walking into the room. You're responsible for your own personal satisfaction that it's clean, and we want to make sure that we impress that upon everyone. You know, we have cleaning supplies available. If we do our best, if you wish to be more particular, here's access to extra stuff. Go at it.
Yeah, I actually like Anne's suggestion better because, you know, I can just imagine a proceeding. I don't think any judge wants to walk into the courtroom and give any kind of a warranty or assurance as to what's been cleaned or what hasn't been cleaned. We just have no way of knowing that. We also don't, I mean, we have very little, you know, staff that would be available. We don't have our own maintenance or cleaning staff of any kind. So we don't have judicial branch personnel that would be able to do that. Obviously, as a judge, I mean, I can wipe down my bench or keyboard or what have you, but I mean, other than that.
So this is CJ. I'll just chime in real quick. Joe, I mean, I think the things that you're touching on are just some of the very many particulars that we'll have to, you know, get figured out here. Because you're right, there can't be somebody just standing there wiping everything down every time somebody gets up and comes in, and so there's going to have to be some self-cleaning, I think, that goes on. I can fully foresee that going on. So.
The other item that's going to be an issue is cleaning the gallery areas. We'd end up having to post somebody in every courtroom to do that cleaning, even if we used electrostatic sprayer with 30-second stay time. How is that? How are we going to do that moving forward? That's another question logistically that we need to think about, because we have no clue what is going to be with any of the people that are coming into the building.
So this is Dawn again. I think these are really good points. And again, another reason why I think that the restrictions should be extended so we can get all, I mean, this is not the forum to solve these issues, but this will give us time to get all of our stakeholders together, walk through everything. As I read the governor's proclamation, opening up, there's capacity limits, 50% capacity limits. So those are all the things that I think we, as this kind of a core group, as we look at all of the different departments in the courts, to put that together to present to the board in the upcoming weeks.
This is John Murphy, and just to give you some idea, I mean, we've had a 20% increase in our in the number of documents we've recorded on as of yesterday, comparing this year to last year. And we're making it work. There's times that we're going above and beyond to meet citizen needs, even, doing whatever we have to make sure that citizens are getting the services that they need. But, I just want to state that, I think Shane alluded to it, and I'll be happy to claim it, that, our office will be closed, absolutely, until June 1 or later. I think the question we have to ask ourselves is what's making our decisions. Is it literally because everybody else is? I'm asking that we don't follow the governor's blind lead on this. We can't help that she is making illogical decisions as this thing is ramping up. We need to make independent decisions. Maybe wild ideas, listen to what the CDC recommends and follow their guidelines. As far as my office, I've been telling people that we're open for business but closed to the public. I think that's a much better message that we should be providing than saying that we're open, because we see the counts getting larger and larger in our front little lobby area. And the goal is, whenever somebody calls, I always tell them, do you have to be here? Because we can do most of this online or through the mail. The goal is to prevent people from coming down to the courthouse. And I think we need to focus with that message that we're open for business but closed to the public. And the last thing I would say is I think we need to look at trying identifying a phased opening, that, yes, there will come a time where the building is going open for purposes. And I know that the sheriff indicated that this would be, he does not want to put that responsibility onto his staff out front, but maybe that's something we can identify as a way to screen people come through. Are you coming here for the courts? No. Well, then everything is done through the mail or online. We could set up barricades basically preventing anybody from going anywhere but the courts at this time. I think it's would hope that, the courts identify maybe a way to look at these dates and see what they can continue to move back. But I think we need to be making independent decisions, not following the blind lead of the governor.
This is
when those
chair
is what they're going to be wearing are the masks. I think that's all stuff that should be required and determined in advance of, hopefully a few days before we ever open.
Can I ask Recorder Murphy, are you requiring your staff to wear a mask right now?
We are not requiring to wear them right now. We have shift work where there's no more than 3 of us at a time, and we're well beyond the 6 feet distancing for social guidelines.
Okay, so as long as they're 6 feet, you're comfortable?
We're 10 to 12 feet right now at all times.
I would, this is Chair Baker. I agree with Dawn. I think right now we're kind of spitballing and piecemealing this from a bunch of different directions. Let's get some input from all of our department heads and elected officials and bring back a plan. We don't necessarily have to develop this plan here. It's good to have input. I will remind everyone I had suggested mandatory masks and didn't get much support. Now it seems like they're becoming more popular. So I'm still in favor of that, but I think that's something that for example, Recorder Murphy, if his group is comfortable without masks and practicing social distancing, that's fine. When people start showing up there, that may change. So I think we need to get a plan in place and bring it back next Monday or Wednesday.
Chairperson Baker, this is Chris Kierski. I just have one comment. Can you hear me?
Yes, go ahead, Chris.
Okay, so number one, the whole point of us being shut down was so our hospitals and our healthcare system would not be overwhelmed with COVID. So if you look at the statistics and our ICU beds are fine, our ventilators are fine. We have capacity to take care of our sick. So the statistics show that we can open up and we can start doing procedures. We have 105 residents here at Sunnycrest Manor, and we just tested 162 staff. It is in the CDC guidelines to wear a mask and actually a shield if it's a cloth mask. So if you're following CDC guidelines, that goes along with the 6-foot personal distance. So I would like everybody to know that we've been in these trenches since the beginning. We've been shut down since March 12th, and we're okay. And we live with it every day, and we're okay. And I just want everybody to know that you can be okay. And for the disinfecting of the tables in the courtroom, I'm kind of shocked that that's a new thing. But anyway, I work in the healthcare, so that's not new for me. But just put a bucket of wipes on the tables in the courtroom and use a bucket of Lysol wipes in between people coming and going. So that's all I have to say.
Thanks, Chris. I want to point out, in case everybody didn't catch that when the testing was taking place, all 162 or 163 employees of Sunnycrest Manor that were tested negative. And I actually will be on KDTH Voices of the Tri-States here in about an hour. It was pre-recorded last night, but we talked about this and the great leadership that's been exhibited by Chris Kirsch and the dedication of her staff taking care of some of our most vulnerable residents of Dubuque County. And I remember Chris saying that the employees shouldn't be afraid of those residents. It would be the residents should be afraid of the employees, because the residents are sheltering in place and without visitors. And Chris has done a great job, and her staff has done a great job up there. So I think we can take examples from an expert that we already have on staff.
Thanks, Dave.
You're welcome.
Mr. Chair, this is Denise Dolan.
Go ahead, Denise.
I guess I would encourage the board this morning to make a motion to extend the current courthouse operations through the end of the month. And then I would hope that Dawn would facilitate a Zoom meeting through department heads and concerned, and Judge Schubat, other parties that want to be a part of it, they could contact Dawn to let them know, or let her know that they wanted to be part of the discussion, and possibly some of it can be a big group email, but some of it could be obviously a Zoom meeting or something like that, so that we can get a proposal to you by then your next formal meeting is the 26th, a week from Mondays, a week from Tuesday.
Right, we have a Tuesday meeting because of the Memorial Day holiday, just pointing that out to everyone.
Right.
Probably a good idea. Dawn, do you have any input or recommendation?
That was my recommendation earlier, and we could have a meeting as quickly as probably tomorrow morning to continue to provide you updates on a reopening plan.
Okay, and I think we're going to have, there's going to be individual department issues that need to be addressed. There's going to be general issues, especially at the courthouse, in the common areas, that type of thing, that we'll need to reach consensus on. And I think you need some time for, hearing from everyone. Again, all the department heads, all the elected officials. And when I say department heads, I'm including Judge LaCar and Judge Schubat in that, and Linda Nilgis as well.
Yes, in extending the restrictions or not extending the restrictions of the public access to our buildings, that does not prevent our department heads and elected officials to continue on with their remote working practices or their social distancing practices. They all have the authority to decide what's the best for their operations and the safety of their employees, even without this extension.
Okay.
This is Linda Nilgis. I would just comment on that as far as what the state is doing in terms of our staffing levels there, the clerk's office and such. We have visited this topic on a number of occasions, and we will be phasing staff back in. So we will continue to have folks working from home and slowly bringing those folks back starting on June 1st. Just so you know, in terms of how many people may be coming into the courthouse related to the staffing levels there. So like I said, starting June 1st, there'll be some that will be working from home, continue to work from home, and some coming back into the office. So we will not be back to full staffing for quite some time. We'll continue with a rotation of staff.
Okay, thank you, Linda. I think, again, we'll let Dawn Sherman convene a meeting and get everyone's input and bring a report back, recommendation back to the Board of Supervisors.
Perfect. Thank you.
Thank you. All right. I am looking at the agenda item. It says discussion, so I don't think there's any, I don't know if we can take action today.
You could do a motion to, since it's
Extend.
on. Yeah, that's how you've been doing in our previous meetings.
Okay. All right.
And Dawn, what date are you recommending?
May 31st.
That means if we don't meet and extend it, what would happen then?
That would start our, that's why we would like to have these meetings, to have a plan in place, whether we would recommend extending it, if we recommend capacity limits. So it would not just be open the
That
door.
would give us 2 weeks to revisit it again.
Correct.
Okay. I will make a motion to continue with the current operations as stated in the emergency management plan document until May 31st.
Second.
Okay, motion made and seconded to extend the current public access rules to May 31st. Is there any other discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Thank you. All right. Next item on the agenda, item F, County Public Health Risk Policy.
Yes, Chair, this is Dawn again. This goes hand in hand with our previous discussion. You have currently had this emergency policy in place through May 15th as well. Just a reminder, this is more of our pay practices. So employees, as we have limited or reduced schedules, they are still receiving full pay during this time. So I'm recommending, based on your previous motion, that we extend this through May 31st as well.
Okay. Any discussion? Questions for Dawn?
Yes, Dawn, I would like to, I'm going to be supportive of this today, but I will not be issuing a routine extension of this again. So starting June 1st, we're going to need to have looked at a new way forward with everybody. So there won't just be another extension. I'll need to have a greater detail from the departments about staff, who's working, how they're working. I think we are going to I think it's time to put in a little bit more accountability. We all are being called to go back to work. And those of us who can balance that and have the privilege to balance that, we're lucky and we're fortunate. But I think I at least want to know in greater detail how this has gone, what the implications been, kind of breaking out some information about the county staff and who's worked at home, how's that gone, who's more efficient, who's been at home on pay and not doing any work. We need to delve in deeper to child care. So I just want everyone to know, and all department heads that are present, that for another extension of this beyond the end of this month, I need to have a significant amount of information.
I appreciate that, Supervisor McDonough, and we're currently ending a pay period, so we will have some additional reports on that. So I will include that in your updates for the reopening date.
This is Linda Nilgis again. I would just add on to that for those that are concerned about daycare, I'm not sure how much you folks have tapped into it, but there is the FFCRA, the new law that could assist in that regard for employees that do have daycare issues?
Linda and Dawn, I don't think I'm speaking out of turn here. I think what we have done has exceeded the federal guidelines at this point, and you're asking us to extend that to the end of the month. I have, I'm going to support that at this time.
Yes, you are. You are correct, Chair Baker. Specifically for the child care benefit that this policy contains, it is a greater benefit than what we are required by law to provide for employees.
Okay, is there a motion from either Supervisors McDonough or Wickham? And that would
I'll make a motion to continue to extend our existing human resources policy during the COVID-19 emergency declaration through May 31st.
Second.
Motion was made and seconded. Is there any additional discussion? Okay. All in favor signify by saying aye.
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 Aye. Carried 3-0. Next item on the agenda is a request to utilize the courthouse parking lot. And that's from one of our neighboring business. And I'm not sure who's handling this, if it's Ed or Chris or Dawn. I'll let one of you jump in.
This is Dawn. So at this time, right before this meeting, County Attorney May had sent an email regarding some concerns he had regarding this request, or some additional ask of the applicant. So if he is available, if he could, I think it would be helpful for you to make your determination if he was able to make comments on it.
You bet. This is CJ. So yeah, in that email I sent this morning, I kind of laid out my thoughts. If you'd be inclined to go forward with the request, and I know one thing that we always probably first discuss is there liability of the county if you go forward with this. I think there is, whether it's somebody falling in the parking lot or somebody getting hit in the parking lot by a car or whatever other unfortunate event would occur. Since you own the property, I think that creates sort of, it's a host issue. So my thinking would be to close that concern would be to require the smokestack to either purchase just a one-day policy or however they can do that, but to show that they have the county covered for any third-party liability, in other words, to somebody else who may get injured in the parking lot. And certainly, I guess, we'd want to make sure that their insurance would cover your property in case one of their participants or somebody on their behalf damaged the county property. My other thinking would be, as I understand the way that they want to do this is the bands would be on top of their building facing the county's parking lot, and then the cars would be facing the smokestack building, I guess, sort of like a drive-in movie theater. But as you know, our parking lot is laid out in angular parking lot, and every other row faces to the north, which would be away from the smokestack building. So I think they're going to have somebody there literally parking the cars so that somebody doesn't try to park in the angled spot and somebody tries to park in one regularly, et cetera. So I think that, so it's to get the cars in there in an orderly fashion, and certainly to help cars leaving, backing up, and making sure people are out of the way. I do think that it would make sense, and I know that they made note that they wouldn't be serving any type of alcohol. Now, which I assume, regardless of what happened with the governor today, I assume they're sticking to that. But I think that it would make prudent sense to require that they have some security, and I think, like I mentioned in there, we could have them hire off-duty deputy sheriffs. might be the best way to do that, for that person or persons to be on site before, during, and after the event in a reasonable amount of time on either end of that. I think also just sort of for traffic flow purposes, I sort of mentioned if the cars came in on 8th Street and then they could only exit onto Iowa through the exits we have. I think there's 4 maybe. That way they would have some semblance of organization that might, would certainly maybe help with the safety issues and whatnot. But again, they would need to have adequate people, helping do that throughout the day. I don't know, they indicated that they would allow the participants to use their restroom facilities in their building. I don't know if that would be adequate. I don't, given the number of cars that could be here and the people in the cars, but it's just sort of a question I kind of crossed my mind. And I think overall, I don't know what kind of level of noise that this will create. I know we're kind of surrounded by all commercial and warehouse type buildings, but there are folks maybe not too terribly far away that do live in the neighborhood. I didn't know if the noise is sort of if there's some, I don't know how you'd really limit that, to be frank with you, other than at some point, I guess if somebody calls, and says, gee, I'm trying to sleep and this is awful noisy, I guess that would be something that might be addressed at that time. And as I understand it, this is to be a process where all the folks stay in their cars the entire time, according to the documentation we received. So I guess the extent that they need to be held responsible for making sure that goes on, because it would probably not be beyond reason that people would get out of cars and start to congregate and whatnot. So, and I don't know the other thing, how many folks this would involve, and I don't know if being in your car, and I don't know what the governor did today about the numbers, but I guess as long as it's all fitting within all of those regulations too. But and again, and you all may have some other thoughts, about what makes it be a more comfortable process to allow it than the items that I brought up. So that really is my thoughts on the matter. I guess with that, I'll stop right there.
This is Chris. Our current insurance schedule that we have for liability insurance for anybody that's doing something doesn't include or cover as any information on this. I or Stella are going to need to contact our insurance agent and see what the requirements would be for them to give us a certificate of liability.
Yeah, I agree, because I think that should be something that's fundamentally picked up by the smokestack for this particular event.
Yes.
Excuse me, this is Mary Hobble. CJ, wouldn't this be similar to the fireworks permits, where they have to send me proof of insurance with Dubuque County named as an additional insured?
Right, Mary. Same kind of, process or, coverage. I want to make sure that the county is named as an additional insured. So if something happens and somebody brings a suit or a claim, and they include the county in that claim liability, that we would have coverage. Absolutely.
Is that the Supervisor Wickham? Is that the same process we have for other events? I mean, this isn't a new concept of having an event at a public facility. What is our current permit and insurance requirements for being on the Heritage Trail, or what Dubuque requires for All That Jazz or River Festival, and a variety of other items?
I don't know, Supervisor Wickham, if I can I don't know the answer to your question.
So maybe we just start with the county. I mean, we've been approving permits for various types of social functions in my 4 years frequently. I would follow that same process. Might be some unique things related to parking and things you identified, and certainly, noise might be a little bit different than, run on the Heritage Trail, but don't we already have the process for this?
This is Supervisor Baker. We do have a process, but normally the location is outside of the city of Dubuque. So this is a neighbor of the Dubuque County Courthouse within the city of Dubuque, asking if they can use our parking lot. So it probably, I think it's similar, but there is a difference in that this falls under the initially the jurisdiction of the city of Dubuque, which is, I think, why we got that memorandum or whatever it was. And I think, I agree that we need to make sure if we're going to do this that we're protected, and if that means an insurance certificate. I think when people have a race, bike race, or a road race, or a walk, they do have to provide insurance as part of our application process. So I don't think having a certificate of insurance is unreasonable. I think we should make sure that that's in place if we're going to do this.
This is Dawn. What I pulled up was our special events application, and so there's some language in there. I don't know if this would be something we would be able to just use this process. It does ask for certificates of insurance. It does have some indemnity language in there. I would look maybe to CJ if we would be able to use this and have them complete this process.
Yeah, Dawn, I would say maybe, whatever we need to kind of change a little bit to make it applicable, but yes, I think so.
This is Chris. The only other concern I would have from a liability standpoint is, did the city approve this? Because that would be one of the pieces of information they would have to provide if they're going to update this, their request.
The original information that was received by the supervisors on, I think it was Sunday, stated that they have been in contact with the city health department, and that the city was requesting in writing something that showed that we were allowing use of the parking lot, along with the fact that they are doing this as a fundraiser, and so I would like to see us be able to facilitate it.
Dawn, can you put back up the actual paperwork that they submitted? I've got multiple screens here, but it would be nice to see. My interpretation of this is that it's likely they're not having an event on our parking lot. They're having their event on their facility, on their building, on their rooftop. And I think they're letting us know that some citizens might choose to park in our parking area. And, if we say no, are we going to barricade the parking lot? I'm not necessarily willing to say we're an official partner in this in any respect because of the social distancing, and I'm not involved in that. Everyone should, go about that business themselves and be respectful, I think. But in terms of the city probably wanted to know whether or not they're going to enforce our 24-hour parking restriction in the parking lot back there. But I'm not interested in being part of this. I think it was a courtesy originally just to say it's probably going to be some folks parking behind you, and they probably will be anyway, whether we deny them.
So I would generally be supportive of this, and I would just, if the group feels from a liability issue we need to follow the same process we've done for other public events, I would recommend that and bring that back to the board, and the board can decide on our normal applications to accept or deny it, or even table it, as potentially Supervisor McDonough might be alluding to. But I generally would agree it is an event on their public and their private space with spillover into public space, which is pretty common.
Right. And I would be, my thought on this would be to deny it. I don't want a new procedure. I don't want a new policy. I don't want to ask. I don't want to keep track of this. If they want to use my parking lot, I park in the parking lot. Sometimes when folks go to the smokestack, they do park in our parking lot. I think that's fine. I don't have a problem with that. But I'm not necessarily interested in monitoring or making sure they keep anything in good condition. I don't want the liability. I don't want to see these things be necessarily, our parking lot is not a gathering space after hours. So I would be inclined to deny this request. I appreciate their courtesy, and I wouldn't necessarily want to be issuing citations or towing anybody, but I'm not a partner to this.
This is Supervisor Baker. I guess for Chris and or Nathan, do we not have monitoring of our parking lot right now with cameras?
Hey, Dave, it's Nathan. Yes, there are security cameras that cover the parking lot from a couple of different angles. Speaking with Shane about this previously, there could be further coverage, and I'm going to work with him on that, but we have coverage of the parking lot. I mean, there's cameras covering it from left to right, so if there was an incident, there would be security footage to review.
This is Shane. Just to chime in on that, I did speak with Darren. The current coverage that we have, there's a camera that kind of sits in the center of the parking lot, but does not oversee the entire parking lot. It's very difficult just due to the height of it. The overhead camera we do have is of the north side of the building. It did sound like they may put in another camera where our old camera location was, but currently we do not have really any view of the far southern end of the parking lot where they would be utilizing.
This is Ed Raber, and so this is a bit of a new thing. It's apparently a new request here, sort of request. I appreciate all the comments from the county employees as well as from the supervisors. I think we've gotten a couple of different avenues to process this, including potentially circling back with the city health department if they were trying to ask what the county's response would be to this. Can we do a little bit more investigation there and bring this back on Monday? And I understand that may be to do nothing, or to deny it, or to approve it.
This is CJ, and I just kind of looking back at this email from the 10th. I mean, they indicate that the city specifically requested that the Dubuque County Courthouse put in writing that Smokestack is allowed to use the courthouse parking lot for this purpose. So I think that as I read it, and maybe I misread it, but above that they say we would like to use the Dubuque County Courthouse parking lot for the quote socially distanced drive-in unquote component. So I didn't read it to mean that they were just sort of letting you know that, we're going to have this thing and some people might be using your parking lot haphazardly. I took it to mean that they needed the parking lot for this thing to go forward. That's how I read it. And again, maybe I misread it.
Well, it's a new day, right? The governor just opened everything up. Maybe they're not even going to want to pursue this.
True. Yeah.
Generally, this is Supervisor Wickham, if they do want our permission to use the courthouse parking lot, I would fully support that. I think it's not our parking lot, it's the public's parking lot, and I would support that, obviously, with consideration and organization.
Supervisor Baker, here, what I would like is for them to go through our application process, and if it meets the criteria, I don't view this as any different than somebody wanting to have an event on Heritage Trail or one of our roads, or if this were in Farley and the town wanted to use our parking lot for something out there. I view it as the same, but I do think they should follow our procedures and fill that application form out for the events. So I would say for today, I don't think we can give approval. I'd like to see the completed application with the insurance document, and if that fits the criteria, then I would be prepared to support it. Okay, is that enough information then? And then somebody will get with them and tell them they need to go through our process?
I can reach out, Supervisor, this is Dawn. I can reach out to them and provide them the forms to fill out.
Okay, thank you. All right. Anything else on that issue? Next up, we have item H, work session with county attorney to discuss strategy in matters that are presently in litigation or where litigation is imminent, where its disclosure would likely to prejudice or disadvantage the position of the governmental body in that litigation pursuant to Iowa Code Section 21.5C.
Supervisor Baker, this is Dawn again. This will need to have a motion to go into the closed session. I believe Mary provided you the letter that we're going to be referencing this. So we would need a motion to go into closed session, and we'd have CJ staying with us. He's the one who's presenting this to you.
Make a motion to go into closed section pursuant to 21.5 sub C.
I will second that.
Okay, motion made and seconded to go into closed session. All in favor signify by saying aye.
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 Carried 3-0. Dawn, I assume there'll be a little bit of time here to make sure we're appropriately in closed session.
Yep. Can you give me just a minute?